Hi there, my name is Dr. Cassandra Cannon of Cannon Psychology, though I prefer to be called Cassie. Welcome to my outcomes page. I always like people to have an idea of what they're getting themselves into and how long they can expect to be in treatment with me. Now, obviously, I can't give you that's Motley Crue, my German Shepherd. Hey, bud. You'll see that too during our sessions. Um, I always like people to have an idea of how long things are going to take, and obviously, it's completely dependent on your treatment goals. But I also have some average numbers that you can look at and get a better idea of what things are like if you decide to work with me. So, first and foremost, I basically only do EMDR. I might take someone who wants to only do CBT or something else, but I basically only do EMDR. Um, and so all of these numbers are based on my patients since October 2018. Um, I don't have any numbers from when I was doing EMDR before that. I was in a residential treatment facility and I was seeing people like twice a week for 90 minutes at a time. Because I only had them for 30 days, and so we were trying to get a lot done. But here, I do 50-minute sessions once a week. I have noticed that if I see someone every other week, they just don't make the same progress. And it just takes twice as long because it feels like they kind of stall in between sessions but like once a week feels like a nice, like each week we get the processing going, your brain is still working on the material in between sessions, and then we kind of push the ball forward a little bit more each week. I will do double sessions, so I'll do 100-minute sessions because my sessions are 50 minutes, and I will do twice a week, but I have to know you first before we can decide what's better for you if that's what you want. Some people really just are completely saturated by the end of a 50-minute session, and so doing a double session would not be wise because they won't make any more progress after that. Some people just need more time to process in between sessions, so I might not feel comfortable doing a 2 sessions a week because it just might not be best for you. So we would have to I would have to get in there and see actually how you process before we would decide to do more than once a week. Another question that people often have is, well, what if I start EMDR and I can't finish all of the treatment targets? And what I will say is I've never had an issue with someone stopping treatment during the treatment episode, so to speak, but you never want to stop a session mid-session because I need to be able to help close down the session and get you back down to a place of feeling centered and grounded before I let you go for the rest of the day. So you never want to stop mid-session because that would be dangerous. But let's say that just some personal things come up and you can't keep working, but you want to come back later. We may be in the middle of your treatment plan. That's okay. You still will have experienced some positive benefits and some healing. And once you've become a patient of mine, I will get you right back in. You don't go back on a wait list. That can be why my wait list sometimes is a little bit long, is because if people are coming back for booster sessions or if somebody needed to take a break and then come back, you just come right back onto my calendar. So feel free to review my stats. These are updated every quarter, and thank you for visiting my page.